If you provide psychiatric and psychotherapy services to Medicare beneficiaries, are you familiar with the requirements for documenting the medical records to ensure the services are covered by Medicare? Documenting and updating your medical records can seem complicated. There are guidelines available to help you in the process. However, the information may be overwhelming when you're trying to determine the specific pieces of information you need to apply to your documentation. In this video, we'll help you understand the documentation requirements for psychiatric and psychotherapy services. Let's start first with initiating the psychotherapy services. You must conduct a psychiatric diagnostic evaluation of the onset illness or suspected illness to establish the treatment plan. For the evaluation, be sure to include these things in your documentation: reason for the evaluation or patient's chief complaint, a referral source, if applicable, history of present illness, including length of existence of problems, symptoms, or conditions, past history, psychiatric, significant medical history and current medications, social history, family history, mental status exam, strengths and liabilities, multi-axis diagnosis or diagnostic impression list including problem list, treatment plan. Now let's talk more about developing and updating that treatment plan. You have an initial plan established. When developing and updating the treatment plan, be sure to include the anticipated length of treatment to the extent possible. This could include the numbers of sessions required and target symptoms. A description of the planned measurables and objective goals related to expected changes in behavior or thought processes. The thought processes and/or medications, the methods of monitoring outcomes, and why the chosen therapy is an appropriate modality. After the psychiatric evaluation has been completed and psychotherapy services begin, there are documentation requirements for each session. Make sure to include necessary updates to the treatment plan, medical necessity, start and stop times, and the psychiatric illness and/or documentation of emotional or behavioral symptoms that are sufficient to alter baseline functioning. Let's spend a moment looking a little closer at the treatment plan and documenting time. And why do we need to focus on these particular elements? Medicare's claim review programs frequently select psychotherapy service claims for review. These programs review the medical records for the medical necessity of the services billed and determine if appropriate payments have been made. These reviews have concluded that insufficient documentation is the common driver of improper payments. Let's take a look at what's often missing in the documentation. The two most frequent errors involve the treatment plan and documenting time. We'll start by discussing the treatment plan. Medicare policies require that the treatment plan will be updated on a periodic basis, generally at least every 3 months. This could be more often if a significant event occurs within the patient's life that could alter the treatment. Depending on the situation, you may also have to determine if a new psychiatric diagnostic evaluation is necessary due to the event in the patient's life. The main factor is making sure it's documented. In medical reviews, we frequently see errors assessed because the treatment plan has not been submitted, or it has been submitted but does not show recent updates. Remember, the treatment plan should be updated on a periodic basis, which is generally at least every 3 months. Next, we'll discuss documenting time. Psychotherapy services are time-based codes. The start and stop time for each session must be documented. In situations where a psychotherapy session is provided with an evaluation and management service, you must also document the total time spent on psychotherapy services during the session. Let's look at the times associated with each code. The descriptor for each current procedural terminology, or CPT code, provides the associated time for that code and whether it includes an evaluation and management service. Notice the codes that include an evaluation and management service are add-on codes. These psychotherapy codes must be billed with the associated evaluation and management code. If these 3 codes are billed independently, they will deny because of the evaluation and management code requirement. We frequently see that time is either missing or not documented properly in the medical record when rendered with the evaluation and management service. Remember, the start and stop time for each psychotherapy session must be documented. Also, when the psychotherapy service is provided with an evaluation and management service, you must also document that total time spent on psychotherapy. So, what can you do to prevent impacts to your claims processing and payment for these services? First, remember to frequently review the treatment plan for updates. Make this a regular process to review the treatment plan after every visit to determine if the updates are necessary. Second, document the time for the psychotherapy session during the visit or immediately after the session has concluded. At the same time, determine the appropriate code based on time spent for the session. Consider if an evaluation and management service was also conducted, requiring an evaluation and management code along with the psychotherapy code. Knowing the documentation and billing requirements and keeping these frequent documentation errors in mind while providing services to your patient will help in preventing issues with your documentation and claims. Review Medicare's policy guidelines and certify your medical documentation supports your services being rendered and documented. We hope you learn more about psychiatric and psychotherapy services. You can visit our website for more resources and to check out our other educational videos. And again, thanks for watching.